Hi, everyone. Welcome to Don't Fall Short on Safety. It's a sunnier day than it was yesterday. Yesterday was like your typical fall day in Chicago. Today is much sunnier. So glad you could join us. My name is Chris Patrick. As I said, I'm a registered nurse and I'm the director of education. We're going to be talking about falls today, and we'll go ahead and get started. So many falls don't cause injuries, but 1 out of 5 falls does cause a serious injury. At least 300,000 older. So these injuries can make it hard for a person to get around, do everyday activities, or live on their own, even if it's not a serious injury. So falls, like I said, can cause broken bones in the wrist, the arm, and ankles, and hip fractures. And they also can cause head injuries. They can be very serious, especially if a person is taking certain medications like blood thinners. An older person who falls and hits their head should see their doctor right away to make sure that they don't have a brain injury. That's really important that you do that, even if you think you didn't hit your head hard, because as we age, our brains shrink a little bit. There's more room for bleeding to accumulate in your brain before you even have signs and symptoms of a hemorrhage or a bleed in the brain. So that's my little tidbit on that. Make sure that if you do hit your head, you have it evaluated in the emergency room. So this is what we're going to talk about today: the physical, emotional, and financial cost of falls, and what happens when someone falls, who's at risk, and prevention of falls in older adults. Now, a definition of a fall is really going to be different inside a community, such as a nursing home, a memory support, assisted living, because it's defined by the state. So if you're outside of the community, you know what a fall is, but inside, it's changing planes, which is consistent with a fall. So in other words, if you're sitting in a chair and you slide out onto the floor, it's considered a fall, even if you don't hurt yourself, and it is reportable. So that's just a little bit of difference when you hear someone fell in a nursing home, or mom says, I fell today, I didn't hurt myself, I just slid out of my chair, my wheelchair. They consider that a fall because they feel that people within a community should have that eye on them to make sure that they're not doing such things. Let's look at this fall statistics, and 1 in 4 Americans age 65 fall each year. So that means every 11 seconds, an older adult is treated in the emergency room for a fall. Each year, 3 million older adults are treated in the emergency room for their fall injuries. Falls with or without injuries also carry a quality of life impact. So a growing number of older adults fear falling, and as a result, they're going to limit their activities and their social engagements, and that can be traumatizing and catastrophic as well, because that's going to result in further physical decline, depression, social isolation, and feelings of helplessness. And you can see that these statistics are from the National Council on Aging. So falls among adults age 65 and older are very costly. 20 to 30% have mild to severe injuries, but it is the underlying cause of 10 to 15% of all emergency visits. 50% of injuries related hospitalizations among 65 and older are related to falls. We see hip fractures, traumatic brain injuries, and upper limb injuries such as broken shoulders, broken arms, broken wrists. They are longer hospital stays compared to other injuries. And we know that 70% of the people over 70, and this is a statistic that has never left my brain. Every time I think about falling as an adult, because I am an older adult, I think of this statistic and it has stuck with me. 70% of the people over 70 die within 18 months of hip fracture. Let me repeat that. 70% of people over 70 die within 18 months of a hip fracture. Excuse me. That is catastrophic, and we know that that when you fracture a hip, it is a major medical event and a lot of stress in your body, and it has a lot of things that can happen after that. We'll talk a little bit more about hip fractures and what people typically will die of from a hip fracture. My dad was a perfect example. He was normal and healthy. He was walking down the stairs. He tripped on his shoelace. He fell down 3 steps, broke his hip. That was in, excuse me, November, and he was gone by July. He was a healthy person before that. But then he started having some cardiac problems, and he then went on to die of leukemia. So, you know that hip, we've got to protect that hip, and think about those statistics when, excuse me a minute, when you don't want to use your walker, you don't want to use your cane, you want to go out on a day that it's icy and rainy. And that will keep you safe, just thinking about that statistic. The cost of a fall injury is over $30,000. That those direct costs don't really account for long-term effects of these injuries, such as disability, dependence on others, lost time from work, unable to do your household duties, and a reduced quality of life. Those are all things that are included in that cost, whether it's financial or impacting that quality of life. Although this is dated 2007 to 226, we can only assume that the rate will increase as the population ages. And so you can see the last time they did this was 2016, and you can see that it increased. So again, and if you look at this statistic, and this was from CDC, 7 fall deaths every hour by 2030, if we continue on that path of falling. So if we look at fall-related injuries, most falls do not cause sufficient injury to receive medical attention. I just returned from vacation, and a friend of mine was getting out of her car after mass, and I was with her, and her foot got caught in a a lump in the concrete, and she tripped and fell, and she fell on her left side. And although she did not break anything, she did not want to go to the emergency room because she's on blood thinners. She had a bruise from her elbow all the way past wrist joint, and that was just from hitting the pavement. So again, not all are sufficient injury to receive medical attention. 3 to 5% of falls in elderly people who reside in communities and nursing homes result in fractures, with fewer than 1% of falls causing hip fractures. And then about 5 to 10% of falls cause other serious injuries requiring medical care. And here we look at hematomas, which is a blood clot, a collection of blood, head trauma, oblique, joint dislocation, or it could be a fracture, and soft tissue injury is what my friend had experienced. So every year, the United States, in the US, there's approximately 220,000 of each hip and wrist fractures in people over the age of 65. Where are we seeing a lot more wrist fractures? Pickleball. Believe it or not, well, yeah, I can believe it. I don't play pickleball, but I've seen people play it, and there's a lot of backwards movement when you're playing pickleball, and so you've got to be careful of your surroundings. And if you've never played pickleball before, maybe that's not something you want to start at the age of 7, unless you are very physically fit. Volunteers. Each year, over 300,000 older people, those 65 and older, are hospitalized for hip fractures. That's more than 95% of hip fractures caused by falling, usually by falling sideways. We're going to talk about the different ways people fall and how it causes different injuries. Interesting, women experience 3/4 more hip fractures than men do. Women are more commonly having osteoporosis, a disease that weakens bones, makes it more likely to fracture. Keep in mind too that the chances of breaking your hip is going to as you get older. So falls and fractures, the stronger determinant of a fracture is the actual fall rather than the bone fragility. So it's the way you fall, what part of your body you fall on. The reason falls are caused by abnormalities in gait and balance, and that will predispose you to fractures. And then physical limitations and physical inability to reduce bone strength and increase fracture risk. That's why we need to get up and move every day. We need to be walking. We need to be exercising. If your gait is off and you're not comfortable walking, there's chair exercises, and we'll talk about what exercise will do and how it'll help you. So we know that falling once doubles falling again. And again, I know it's repetition, but these fall injuries result in hip fractures, broken bones, head injuries, and it can limit one's independence. So how does it limit it? Well, what happens is that person may fear what caused them to fall before, and then they're going to cut down on their daily activities, which will cause them a decline in their bone fractures. And then we all need to keep that the caregiver, it impacts the caregiver as well. We can't forget them, because research has shown that after a care recipient's first fall, caregivers report a significant increase in caregiver burden, fear of falling, and depression. And there's also a change in routine. And we have seen people that take their loved one or their person that they're caregiving to the emergency room because they don't know what to do as they keep falling at home. So they're afraid they're going to get hurt on their watch, and that causes an increased burden on them. Over 800,000 patients a year are hospitalized because of fall injury, and again, mostly hip fracture. So the financial toll for older adults falls is expected to increase as population ages. Now, the average hospital cost for falls is $30,000. That's just the ER and maybe the admission. That's not counting the surgery. We're not counting the rehab. We're not counting the medicine. That's just the cost of the fall itself. We also know that there are psychological effects of falling. The first one is increased fear of falling. I have fallen once. It was my own fault. I was negligent because you know what I was doing when I fell? I was reading my phone. And since then, I've never touched my phone when I'm walking. It's just not going to happen again. But I will tell you, for about 6 months after that fall, there was an increased anxiety of falling again. And I was super vigilant I knew enough not to stop my activities or reduce my activities because that would only cause me to be weaker. But I had to force myself, and I was very vigilant about not falling again. So the psychological effects from falling can be catastrophic in the long run, causing future falls. They tend to limit activities and social engagement. We see an increased risk of depression, social isolation, and hopelessness. This is what we call post-fall syndrome. And if you look at the diagram, you'll see that once a person falls, they may have fear that they will fall again. So here they have the fall, they fear that the fall is going to happen again. Then they begin that avoidance behavior, which is easy to do. I really had to talk myself out of that because that's just going to cause inactivity. And with that inactivity, you're going to see physical deconditioning. That leads to muscle weakness and gait instability. And there becomes a greater risk for fall. So then you have this fear of fall again. And this keeps going in a circle. This fear creates avoidance behavior, inactivity, deconditioning, gait instability, and this all increases your risk for future falls. It's a vicious cycle. And once you get in it, it's difficult to get out. So let's talk about what are some of the risks for falls. First, there's physical. The changes in the body that increase risk of falls. Osteoporosis, there's a definite change in the muscle mass as we get older, and weight loss. So you see that your body is deconditioning itself as we age. That's why we have to kind of stay on top of it. And then we have behavioral things that seniors do and don't do that increase the risk of falls. Environmental, in the home or the community. So we need to talk about how we can make our houses safer so we're not tripping over things in the house. So let's look at each one of those. It's itself to a higher risk of falls. Other chronic conditions may increase your risk for falls, such as Parkinson's disease and some dementias. One physical condition that can cause falls is something called postural hypotension. And that's a drop in blood pressure when changing positions, such as moving from a lying position to a sitting position, or a lying position to a sitting position to a standing position. So for an older adult who has postural hypotension, changing positions might cause a drop in blood pressure. And when you have that drop in blood pressure, you're going to become dizzy, and that may cause you to fall. So just changing your routine a little bit. When you get up in the morning or get up from a nap, you're going to sit on the side of the bed. You're going to drink a little bit of water. You're going to sit there for a few minutes till you feel like you're a little bit stronger. You're going to have your walker in front of you. You're going to slowly stand up. And then you're going to stay standing for a minute just to see how you're feeling. Make sure you're not dizzy. So you're checking yourself, and you're taking it a little bit slower than we normally do when we get up and move from one position to another. Although people with postural hypotension have no symptoms, others do. And they can differ from person to person, but they might include dizziness and lightheadedness, like I said, feeling like you're going to faint, passing out or falling, having a headache, blurred vision or tunnel vision, feeling vague or muddled, feeling pressure across the back of your shoulders or your neck, feeling nauseous or hot and clammy, weak or fatigued. Those are all symptoms of postural hypotension. And again, that's going to vary from person to person. So it can be caused or linked to heart failure, atherosclerosis, or hardening of the arteries. Some diuretics will cause that, some antidepressants or medications to lower blood pressure. And then neurological conditions like Parkinson's disease and some types of dementia, dehydration, a decrease in vitamin B12 or anemia, alcoholism, and prolonged bed rest can cause postural hypotension. So if you've had any of these symptoms, you need to let your caregiver, your healthcare professional know. So age and gender, loss of muscle strength, physical disabilities, impaired control of balance and gait. I have an uncle who had a back injury many years ago, and so he kind of walks very bent over, and he was having really a hard time controlling which way he was going because our bodies were made to walk upright, and now he's kind of bent over and he had his hands behind him, and I don't know if that was giving him a sense of balance, but I encouraged him and he finally started using a walker, and just seeing him use the walker, he's actually standing up a little straighter, but he's more confident in his walking. He's moving a little bit faster, but not too fast. And I think he feels like he has more control of his environment. So as much as I don't like walkers and canes, they do have a purpose and they do help us. Vision changes can cause us not to see things that might be in our way. And so we'll bump into them and fall. And then or acute illnesses. I'm gonna go back to the vision changes really quick and just mention that if you're on oxygen at home and you have oxygen tubing and it's clear, and you have carpeting or you have even just a wood floor, you're not going to see that oxygen tubing very well on that floor. You can ask your oxygen company for color tubing, or just go to the store and get orange, you can get it at Menards, orange tape, and just periodically put orange tape on your oxygen tubing so it sits out and you can see it. We know that aging affects falls. We know that there's, as I said, our risk of fall increases as we age. And if we discontinue exercises, it's really going to be a problem. We can modify our exercising. It's a great way to keep our muscles conditioned. So sitting in a chair, doing sitting yoga, doing sitting breathing and relaxation, or there's now something called sit tap dance where you're tap dancing to music and you got your tap shoes on, but you're moving your legs back and forth. And as I'm telling you about this, I'm tap dancing. But that gets, you're building strength in your legs, which you need obviously to move around. Nutrition, I talked about a decrease in vitamin B12 and making sure that you have enough nutrients, protein, something we need. So make sure that your food just doesn't consist of carbohydrates and sweets, which will, if you're diabetic, it's going to screw up your blood sugar. So make sure you're looking at your nutrition. We'll talk about each one of these things individually. Behavior, as I said, having a fall previous is going to cause you to be that vicious cycle. We all know that we've had inadequate rest and we just don't feel the best next day. So we need to make sure we're getting enough rest. Excessive alcohol or drug use. We've talked about inactivity. Inadequate falling, which means that you're kind of slumping, which means you don't have a lot of good upper body strength. So again, something to think about. Fear of falling that we talked about, and then uncontrolled diabetes. If you're having uncontrolled diabetes, it can cause serious drops in blood sugar, increasing their risk for falls. Now let's look at environmental, because most falls do occur at home, since this is where we spend most of our time. However, having awareness of your surroundings outside your home is also important. And as people age and they normally lose weight, their clothes may become too big for them, causing them to have trips or falls. I spoke to a paramedic recently who works in a community, not a senior community. He works out in one of the suburbs. But it's an aging community, so there are a lot of older adults. He estimated, I asked him, what's your biggest call in 24 hours? And he said most calls, approximately 40% of the calls in a 24-hour period are falls. And I then asked him, what are the falls caused from? He said, number one, loose rugs, followed by inadequate lighting, followed by deconditioning. People who just aren't healthy enough to get up and move, and they end up falling. He also noticed that about 30% of them just needed assistance getting up and did not sustain injury. But remember, once you fall, that doubles your chances of falling in the next 6 months. That's why a doctor will ask you when you go for your Medicare exam, have you fallen in the last 6 months? And if you have, that increases your falls again by 30%. He also noted that many of those falls are at night when the person is found between the bed and the wall on their way to the bathroom. So consider this. Is it the placement of the bedroom furniture, giving the person, not giving that person a clear path? Are they getting up too fast? Maybe it's the hypotension. Or is it poor lighting? All of these things should be considered. I know that this paramedic that I asked is my son. And the one thing all firehouses, not all firefighters do this, but in his particular house, they always have extra light bulbs in their truck. And if they go into a home and the lights aren't working, they will put a new light bulb in for that elderly person. So lighting is very important too. All right, so now we're getting on to how to reduce falls, because I think that's really the important thing, is prevent them and reduce them. So again, I know that for some of you, oh yeah, exercise, but it's really important. But always make sure you're talking to a healthcare provider before you engage in any activity. We know statistically that regular exercise reduces the risk of falls. Strength or resistant training is important. What they're finding now is that because of osteoporosis in women as they're going through menopause, that's really when we see a significant change in bone strength, is they're suggesting that women start strength training in their 40s. And so I have a daughter who's in her 40s, and she's doing strength and resistance training, and she wears a weighted vest. You really don't want to put the weights on your ankles because it can cause damage to the ankles. So you want to use a weighted vest, but you don't have to do that. Strength training can be sitting on your couch with a 5-pound weight or a can of beans in both hands, and do strength training or resistance, getting yourself some cheap resistance bands. You can get those at Amazon, and then pull up a worksheet on doing resistance training while you're sitting. Balancing exercises, standing at your countertop and balancing on one foot for a while you're holding on to the counter, and then let go of the counter for a minute. You don't want to be too far away because you want to be able to grab that counter if you feel like you're losing your balance. Count that. Water exercises are excellent for balance training. I've been doing water aerobics now, and we do a lot of balance training in the water, which is helpful. Walking is helpful. I was on vacation for 2 weeks and had the opportunity to walk every day. I was walking 6,000 to 8,000 steps a day. You don't have to do 10,000. Some guy made that up and decided that was to be the polished norm. And we know anything above 5,000 steps a day, getting up and walking around your house is helpful. You don't have to be outside, but walking is important. We've talked about chair exercises, and there is a couple of these. If you want to take a picture of this screen, there's evidence-based fall prevention programs that you can pull up online. One is Matter of Balance. The other one is Staying Active and Independent for Life. And there's another one called Stepping On. And all three of those you can find online. You can also find exercises for older adults on YouTube, or you can also go to SREADI. That's SREADI, and look at their website, exercises that improve lower extremities strength and improve balance. But we also have to make sure that we're doing our upper body strength as well, because that's what you're going to need if you do fall and you are able to get up. So a couple things: wear proper shoes or slippers. You don't want to wear flip-flops. You need to make sure that you're wearing shoes that cover your foot and have a good solid treaded base on it, even in your slippers. A good company, and again, I'm not advertising for anybody, but I get my shoes at a company called OrthoFeet. And it's for people that have problems with their arches, but they also have a very good treading on the bottom. They also have slip-on shoes. A lot of people fall because they try to put their shoes on while they're standing up. If you don't have slip-on gym shoes or slip-on shoes, sit down while you're putting your shoes on. Make sure that when you tie your shoes, the shoe ties are tied up enough so they're not over the side. And so make sure that you're wearing great shoes and making sure that that you're doing that. You need to have grab bars in your bathroom, toilet and shower. Very important to have those grab bars. Shower pad with a suction inside the tub, unless your tub or your shower has a graded non-skid floor actually built into it. We're just redoing our, and we're getting grab bars placement in our bathroom, in our shower, one as you're going in and one on the side. But also I'm paying a little extra for the gradiated so I don't have to put a shower pad in there. But if you don't have that, it's advisable that you use a shower pad that has suction so you're not slipping on that. You also need a non-slip rug near your bathtub and a clean, clear path to your bathroom. When we're in the kitchen, make sure that you have a non-slip rug at the kitchen sink, along with proper lighting, handrails for stairs inside and out, good sole shoes. Like I said, make sure that they have good treads on them. Grabbers to reach top cabinets is important. I use my grabber all the time. And I use it to grab things out of the top shelves any place in my house. I have one in my garage and one in my house. So there's one, I don't have to go find one. Your bedding. I have a friend who was getting up to go to the bathroom at night and slipped on that little corner of the bedding and tripped, broke her wrist. So make sure your bedding is tucked in and it's not out where you can trip on it. Make sure that you're keeping rubbish, electrical cords, stacks of magazines, and papers out of your path. I think it's really important that that stuff is out of your path so you're not tripping and falling over it. All right, this is an exercise.
There's an underlying myth that falls are an inevitable.
This is a strength and balance exercise when talking about it for older adults. Here we go.
Thing. Exercise. You see, starting at 30, our muscles can lose up to 8% of their strength every decade. So, by the time we're 80, we've potentially lost 4% of strength. We can help reverse this trend, though. with 6 simple exercises widely used by physiotherapists to keep us mobile and independent as we age. All you need is a steady support, sensible shoes, and a little time each day. Exercise 1. Heel raises. Stand tall and hold your support. Then lift your heels off the floor, taking your weight through the front part of your feet. Hold this position for 3 seconds. Then slowly lower your heels to the floor. Repeat this 10 times. Exercise 2. Toe raises. Stand tall and hold your support again. This time, raise your toes, taking your weight in your heels. Keep upright and don't stick your bottom out. Hold this position for 3 seconds, then slowly lower your toes. Repeat this 10 times. Exercise 3. Heel toe stand. Stand tall sideways on your support, with one hand on your support. Now put one foot directly in front of the other to make a straight line as shown. While looking ahead, take your hand off the support if you can and balance for 10 seconds. Take your front foot back to hip width apart and place the other foot in front instead. Balance again for 10 seconds. Exercise 4. One leg stand. Stand close to your support and hold it with one hand. Now balance on one leg, keeping the support knee soft and your posture upright. Hold this position for 10 seconds. Then repeat on the other leg. Exercise 5. Heel toe walking. We'll be walking forwards for this one, so use a support like a sideboard. Stand tall with one hand on your support. Feet form a straight line. Then move the back foot in front of the other. Continue a steady walking action for 10 steps. Then, take the feet back to hip width apart. Turn around and repeat the steps in the other direction.
So these are just some really good exercises that you can do at home. Let's talk about some of the medications that can, just medications in general, that cause problems. We need to reconcile our medications regularly. Don't keep medications that you're not using in the cabinet with medications that you're currently using. Make sure that you're checking them with your doctor. You should be checking medications with your doctor usually about every 4 to 6 months, although we know that doesn't happen. But if you have any questions about your medications and why you're taking them, and look at their side effects when you're starting a new medication. I know sometimes looking those side effects can be kind of scary, but you know, maybe dizziness and lightheadedness is one of the side effects. In an older adult, we don't want to have that. So we need to report any side effects after starting any medications. And medication side effects that increase the risk of falls are anything that causes vertigo, dizziness, and lightheadedness. A drop in pressure when standing. So I want to mention that I know, you know, many of us are trying to look at our body fat and our ratio and trying to reduce that and get healthier. But if you're on a blood pressure medicine and you start to feel lightheaded and dizzy and you never did before, it might be because your blood pressure now is too low, because oftentimes when you lose weight, your blood pressure will shift also. So again, if you're on a diet, if you're taking medication for, you know, to lose weight, keep an eye on that. Make sure that you're taking your blood pressure and it's falling within the norm. And if it's not, or if you're starting to get dizzy, you need to let your doctor know. You might have, just with some medications, difficulty with balance or slow reaction, loss of concentration or decreased alertness, and lethargy, which can increase your risk for falls. And some do have blurred vision. So those that are a fall risk are anticonvulsants, antidepressants, antihypertensives, so ones that lower your blood pressure, antipsychotics and antispasmodics, benzodiazepines, opioids, sedatives, hypnotic, and tricyclic antidepressants. If you're on any of those medications, discuss with your doctor. And if you're just starting one of those medications, watch out for any of those symptoms that could cause you to fall. Next is our nutrition. That's the other battle. We have to think about how we're eating. About, like I said, 30% of the people that go into the emergency room every day because they're confused or they're falling or they don't feel right is because they are dehydrated. Older adults don't drink enough water. Coffee and tea, if it's not decaffeinated, is going to dehydrate you. So make sure you're having about 8-ounce glasses of water every day. And that's really hard to choke down if you're not a water drinker. So my little trick is to fill a small cup and drink that, and then fill it again, and then in a little while drink another. Eventually you'll get it if you're doing that every so often during the day, but keep yourself hydrated. Because nutrition does assist in strength and mobility, we need to make sure that we're getting enough protein, getting enough vitamin, and we're getting enough calcium. We need to watch for signs of weight loss or weight gain because that can shift things as well. And if you're recovering from a fall, make sure that you're making sure you increase your protein and your calcium, and make sure you're eating healthy and avoiding dehydration by increasing your water intake. You should see your eye doctor once a year. Make sure you're wearing your glasses that are most current prescription. Be aware of changes in your vision. So if you start to see cloudiness or flashing lights, or if you're having difficulty with spatial relations, you can't, maybe your perception feels off, you need to make sure you see your doctor, your eye doctor. And talk to your doctor when they suggest having your cataracts, if you have cataracts, having them removed. You should have a hearing test regularly, not wait until someone says, I think you're deaf, because that probably means you have that you have probably had a hearing problem for a while. So make sure that you're having your hearing checked annually, and encourage the use of your hearing aids if you use them. There's 2 reasons you want to use your hearing aids. First of all, it'll alert you that there's something around you that could be a hazard, but also using your hearing aids and hearing more stimulates your brain and reduces your risk of getting dementia. So you should be wearing your hearing aids every day. Someone said, I was talking to an audiologist, and she said, you know, I was talking to an older person about her hearing, and she said, well, when I'm at home, I don't wear my hearing aid. Why do I want to hear my dryer? And the audiologist said, because hearing that dryer stimulates the hearing part of your brain. So even if it's an you know, a sound that you really don't care to hear, it's important that your brain takes that and is able to, you know, hear that in that hearing part of your brain, because it'll stimulate all those neurons. Talk to your provider, discuss your concerns, bring your list of prescriptions and over-the-counter medications. Don't forget to tell them what the counter medications you take and what supplements you're taking. And discuss with your doctor and be honest. What's your normal physical activity level? Then talk about some assisted devices, canes and walkers, and a wheelchair or scooter if you need one. And then ask for a risk evaluation. Again, the one that you can find online is STADI. Another, and that stands for Stopping Elderly Accidents and Deaths. So STEADI, you can find that online. I think that's the CDC, or they might have a whole risk fall area. These are some steps to prevent falls.
Hey, be careful. You might think you're never going to fall, but we all know someone who has, don't we? Next time, it could be you. The good news is most falls are preventable. Start with 6 easy steps. First, find a balance or exercise program to help you build stability, strength, and flexibility. Make it fun and go with a friend. Don't be afraid to tell your doctor if you've had a fall or are afraid of falling. Ask her to assess your risk of falling. Discuss medications with your pharmacist or doctor. They'll know what prescriptions and over-the-counter medications can increase your risk of falling. Make sure you get your vision and hearing checked every year because your eyes and ears are key to keeping you on your feet. Keep your home safe. For example, remove any items you might trip over. Make sure your home is well lit. Use bath mats in your shower and install grab bars in the bathroom. And finally, remember, it's important to talk to your family. Ask for their support in taking these simple steps to stay safe. Falls are not a normal part of aging. But every 13 seconds, an older adult visits an emergency room for a fall-related injury. Luckily, you can take steps to reduce your risk. Visit ncoa.org/falls prevention.
All right. These are just some fall risk assessments that are done. Probably most common is, and I think I have a little short video, it's called Time to Up and Go. That's one that you'll see done most often in a doctor's office or in a community setting. So it usually can be done by a healthcare professional who's trained in fall risk assessment. Physical therapy is the people that would follow up for every fall. And I think this is, well, we'll talk about use of assisted devices. Let's go back to that. All right. It's not showing up. The one slide is not showing up on that, but let me just tell you, get the right equipment. By the time most of us are 70s, our balance will be starting to falter, and a cane can help that stability while reducing strain on the legs and being an easy portable device to keep around. I have a friend who just keeps a cane in her car. If she feels by the end of the day that she's fatigued and she needs it, she uses it to get out of the car and go into maybe the grocery store or whatever. So use canes and walkers if you need them and as you need them. Don't vanity get in your way. Think of such devices as a sign of your activism, intelligent approach to aging well. Oftentimes, healthcare providers see older adults using a walker that's not right, and it's not the right fit for them. So you can always have physical therapy fix your walker to make sure that it's not too high for you or not too low for you. The top of your walker really should be even with the crease in the underside of your wrist when your arms are relaxed at your side. Walkers that are too low really can cause you to stoop over while you walk, and that can impede that proper body mechanic. If your walker is in the wrong height, it may be prone to give you some aches and pains. So again, physical therapists can help with that. If you discover that someone you know has fallen, calm. If injured, call 911 immediately. Don't attempt to move the older adult. You're not going to know if their hip is broken unless they're evaluated by a healthcare professional. They may think it's not broken, but it is. Sometimes, you know, with that the release of the stress hormone, may not feel that pain right away. And so they'll say, I'm fine, and then they'll try to roll over or whatever, and they'll feel a lot of pain. So you know, let them stay in that position. If they are safe and they don't think they've heard anything and they insist on getting up, but again, make sure that they're safe to do that. You want to roll them to one side, and then you want to get on your hands and knees, find a sturdy chair, put your hands on the chair, one foot up so one knee is kneeling, and slowly rise. That's not going to be easy for everyone to do. So again, you may have to call for help. So giving the gift of fall prevention when you're thinking of what to get an older adult for Christmas this year. How about a fall alarm system? There's a lot of them on the market now. It doesn't have to be a thing you wear around your neck. It looks like, an Apple phone. How about a raised toilet? So they're not bending down as much to go to the toilet. You want to get a higher level toilet. How about paying for their new eyeglasses this year? Eyeglasses can be very expensive. And so sometimes if you're on a very fixed income, it's hard to do. If you go to places like Walmart or Costco has a great selection of eyeglasses. And they also have a wonderful, a good price on hearing aids. That's where I get my hearing aids from. And they're much cheaper. Grab bars, make sure that offer to put grab bars in the bathrooms, and make sure that there's ratings on both sides of the stairs. Automatic lights and timers for stairways inside and outside the house, and then a small flashlight maybe attached to keys. Those are all nice gifts to give someone when you can't think of anything else to do. Now let's talk about rising for fall, because it's right around the corner. And we know that, we've got to be extra careful. We've been really lucky. We've had some light winters. I don't know what the Farmer's Almanac has said about this winter, but make sure that we're choosing winter shoes that have rubber soles and good treads. Look at the treads on your shoes. If they look worn, get rid of them and buy yourself some new shoes, especially this winter. You can actually buy spiked that you can put on your soles of your shoes for extra stability. I've seen those advertised on Amazon. Attach an ice gripper cane tip that has spikes on the bottom. So if you're using a cane, it can help you stabilize on the ice, which you shouldn't be walking on anyways. Consider converting wheelchair tires to snow tires. Yes, they do have snow tires. But next one, I think a really practical tip that I use myself. I don't have a cat, but I have kitty litter in my garage, and I grab some and I put it in a little plastic bag. And I put it in my car on the front seat on the floor. And if I have to get out, let's say I'm going someplace, doctor's office, grocery store, and it looks like it's snowy and icy and I'm fearing that I might fall, I take that kitty litter and I throw it on as I'm walking, and it will give me some traction. So kitty litter is a great thing to use. These are the three I talked about. Here's the spike on canes, and these are the spikes that you can just put on your regular shoes. So I think we've talked about some of the safety issues. We've talked about falling. These are some of the sources that I use that might be helpful for you. And I want to thank you for coming today, and I will see if there's any questions.